5 minutes of questions.
Thank you, Mr. Chairman. I'm trying to get in two questions to Dr. Mello and one to Dr. Wright, so bear with me here. Dr. Mello, we're witnessing a significant increase in AI-driven medical product development. Given the rapidly expanding technologies, we must ensure that we also better understand and evaluate how these AI-enabled devices function so they don't put patients at risk. So my question, or first question, to achieve this, do we have the appropriate regulatory framework in place, and does the FDA's current statutory authority allow the agency to be nimble in its oversight of AI-enabled devices, if you will?
Thank you for the question. I'll answer the second part first. I think the agency has been remarkably nimble given what they have to work with. But what they have to work with does not allow a great deal of maneuvering room. So absolutely, there needs to be modernization to solve two problems. One is that they can't do enough, and one is that the statutory framework requires them to do too much or the wrong things given the type of technology that they've confronted now, as Dr. Ibrahim has said.
Okay. And I'm also concerned that there are insufficient guardrails in place to protect patients from bias in AI and coverage denials for necessary care. In July, the Trump administration announced the Wasteful and Inappropriate Service Reduction Model, which would impose prior authorization in traditional Medicare and allow for profit companies to use AI to perform prior authorization reviews. And I'm concerned that this AI model will result in denials of life-saving care and incentivize companies to restrict care. So my question is, how can we ensure that these algorithms are not being misused to delay and deny life-saving care for patients, if you will?
Right, so the WISER program really raises two questions. One is, when we take a process that is fundamentally and for a long period of time flawed and put it into traditional Medicare, what would we expect to happen? And then the second is, when you take that process, prior authorization, and amp it up with AI, what will change? I think we have pretty good evidence that prior authorization as a process itself is fraught, that there are high rates of wrongful denials, low rates of appeal, high rates of overturn on appeal. So we should have some concern about any effort to expand its use, while at the same time recognizing that in some areas, including, I will say, the areas that WISER currently targets, it is a necessary cost control. And the question is how you do it. And then the second issue is what happens when you bring AI into the game. And there, we don't know. We don't know because there are no publicly available information that would enable somebody like me to be able to tell you, does using AI make prior authorization better for patients or worse? Because I think both outcomes are very possible.
All right. Let me go to Dr. Wright. Another area of concern is the intersection of mental health and AI. If I could, Mr. Chairman, I'd request that the Washington Post article titled, "What is AI Psychosis and How Can ChatGPT Affect Your Mental Health?" be submitted into the record, if you will, Mr. Chairman?
You have the date on that?
What's that?
We've been submitting that.
I think
The
you
date?
have it, but if not.
We have it? Okay. Yeah, without objection,
All right, thank
so
you.
ordered.
So, Dr. Wright, the question is, the American Psychological Association issued a health advisory on AI and adolescent well-being in June, calling for robust protections for young people interacting with AI, urging developers to implement safety features, and for educators and parents to foster comprehensive AI literacy. So can you share information on what prompted APA to issue this advisory and what your members are seeing in their practices that would relate to that?
Thank you for the question. Yeah, APA really felt a sense of urgency to look at what the psychological science has to say in this space, because as we've said, AI development is just outpacing the research and the guardrails. And we've been hearing from both clinicians who are seeing patients that are coming in with their ChatGPT advice, and we've heard the public stories like the Washington Post story you just mentioned about the harms that seemingly are happening, in part because, to Ms. DeGette's point, we have a broken mental health system. And so people are seeking out help wherever they can find it. And that, while very human, might not be a best idea. And so I see a future where, we will have mental health options that are more appropriate, that do utilize AI, but that's just not what's on the commercial market right now. And so helping parents, teachers, educators, technologists understand what does the psychological science say about how to do this well, and what are the considerations that need to be factored in is a huge part of why we put out that advisory and why we're also standing up a second advisory more specific to the use of these wellness chatbots and these general chatbots.
Thank you. Thank you, Mr. Chairman.